Good morning, everyone. Welcome. I see we have folks joining after sitting in the waiting room for us to get ready. Welcome, DO students, residents. We're going to be starting soon with Dr. Gimple. Welcome. If you can see behind me, for those of you who joined us last week, I'm actually in our offices here in the Philadelphia area today. My giant plant, they made fun of my other plant. I have a smaller plant. This is actually fake. This is my IKEA plant. But my big giant plant that looked like it was going to attack me last week, that is at my home. And it has a name, and her name is Stella. But she's not with us today because I'm in our offices. Up to over 170 have logged on so far. So we're a little bit before 1 o'clock. I'm gonna get started a little bit with some housekeeping. We'll give us as much time as we can for other things. We have this, today is our part 2 of our webinar series, COMLEX-USA Challenges in the Face of COVID-19. We're so happy to be back with you to give you this week's update and address your questions. We have uploaded last week's webinar. If anyone is here that missed it, we did upload that into our COVID-19 microsite. That's nbome.org/COVID-19. There's lots of fun tiles that have lots of great information on there, including 2 tiles of interest to this particular program. One is the tile that includes the recordings of the webinars, and the other is the tile that has the FAQ. So what we did was we went through your questions that you had submitted before last week. We went through the questions that you submitted during last week's webinar, and we put together some frequently asked questions there. But the week has changed. That's stating the obvious. So as we are seeing, and so are the questions. So we're back with you today. Just a reminder, if you have questions, please put them under the Q&A down there, not the chat. We are monitoring the chat, and we'll be putting things in the chat like websites and phone numbers and things like that that you might need. But the Q&A also is not visible to you. I know there was a lot of confusion on that last week. You could only see the Q&A once I make a question active that we will hope to answer it during the Q&A. It doesn't mean we'll necessarily get to it. It depends on how many questions and all the other things. But again, we're going to give you an FAQ after today. So we will be going through all of those. We're going to be going back to all of our folks in clinical skills testing and in our computer-based exams and COMET or any of the questions that you might have, our residency program teams. So we're going to make sure that we get those questions answered for you. And again, I'd like to introduce Dr. John Gimple to begin a very short presentation so we can get right to those questions you have. Dr. Gimple.
Yes, thanks, Dr. Sandella, and good afternoon to everyone. I understand there's, at least from the grid here, it looks like about almost 300 of you have elected to spend some more time with us. I hope that those, as Dr. Sandella said, who have not been able to view the webinar from last week, that you'll go and take advantage of that. That's why we recorded it and posted it. We also have posted the frequently asked questions documents. I also apologize, there's some storms in the area here in Philadelphia. I'm in our Philadelphia national offices here, and there are some storms, and I'm getting some signals about instability of the internet. So I apologize if I cut out or the like. Let me check now and just do a voice check, and somebody give me, Dr. Sandella or Andrea, give me an okay if my connection is live. Okay, good. Looks like we're still up and running. We've had several other webinar connections this week with stakeholder groups, and for the DO student groups, we have kept the Council of Osteopathic Student Government Presidents very informed and have continued to get their feedback on a number of issues related to COMLEX-USA in this COVID era, both the Prometric-based tests as well as the level 2 PE clinical skills exam. And we had a very good session on, I believe it was Wednesday PM, with the executive board of the COSGP, the Council of Student Government Leaders there, and had some great questions, some great engagement. Obviously, since there was an announcement this week from the USMLE about their Step 2 CS clinical skills exam, there were a lot of questions related to the PE exam, both with the council, the executive board of the council, as well as questions that have come in through NBOME or through social media and such. So Laura actually gave me some advice and follow-up in terms of just saying, because we had said that this session was going to be very brief in terms of the update and then really run down the questions. But she said it would be a good idea, so I'm going to follow her advice about give a quick update about the PE exam, a quick update about some of the frequently asked questions from last week's webinar, and then just a little bit of information about our continued work with Prometric and such. So I will do that and just spend a couple of minutes, and then we'll be able to spend probably 50 minutes on the additional questions either that we did not get to last week or additional ones that have cropped up this week. First question that we've gotten quite a bit about, and Laura suggested I just start with a follow-up about the level 2 PE. That's the performance evaluation component to COMLEX, the clinical skills exam, is that the USMLE made an announcement on Tuesday night that they were going to suspend, or in other words, further suspend their Step 2 CS exam that the international medical graduates and the MD students take as part of their licensure series. We were aware that this was a potential circumstance. We are in regular contact with the USMLE program, and we're aware that they had major logistical challenges with 35,000 or so students and international medical graduates that they test, and a huge backlog in testing. Because of that backlog, I think we're somewhat overwhelmed by the ability to kind of make that up. Luckily for us, with the DO student population, about 25% of the students in the graduating class of 2021 had already finished the level 2 PE exam for this year, and our smaller numbers overall leave us about 5,500 to 6,000 students in that graduating year next year that still desire to take the clinical skills exam, either prior to graduation or obviously prior to moving on. And we have continued to announce that, yes, we likewise have suspended the level 2 PE exam. We haven't given a level 2 PE exam since March 6th, but that our suspension had a target of July 1. And that is the target for resumption of the level 2 PE exam. It is not a firm target in terms of it is the target. It is when we hope to resume the exam, but there are a number of things that continue to need to happen for us to resume the exam on that date, and in the month of July, in the month of August, for example. And many of those involve all of the modifications to both the exam administration format and the physical spaces, the physical testing centers that we have here in Chicago, well, here in Philadelphia, and also in our Chicago National Center. And I won't go into detail unless there's a lot more further questions about that, but those physical distancing precautions involve less number of students in the center, physical spacing, face masks, clear face masks, so that you can still interpret facial expressions. You know, gloves, thermometer checking, potentially other checking of staff and what have you. Just a long list of extensive cleaning and even HVAC related aspects that keep our centers very, very, you know, safe, and will enable that testing to be done when it does resume to be as safe as certainly possible. We recognize a lot of the questions that we've gotten are about safety, and I'll leave that for further follow-up questions, but rest assured that your safety and the safety of our staff and the safety of everybody involved remains front and center in our priorities. And just like we did with the Prometric Test Center suspension, where we suspended exams until May 1st, and then reinstituted exams, but instituted them under safer provisions with more space in the centers and face masks and all the different things that we do to make people safe. We plan to only resume that exam when we have all of the information needed. One last thing I'll say about that is, in addition to public health expert inspection reviews and other information in our centers that will help us to give us that assurance, we actually invited the COSGP to send us one of the leaders, maybe a fourth-year student who's already completed the level 2 PE, who could come to our Philadelphia center and do a walkthrough prior to resumption of that exam, even help participate in the video that we're creating that shows any potential examinees, all of the different safety circumstances that are being done to make that exam safe, so that, again, as a candidate, as a student, you can make a decision as to when it is you feel you'd like to come and take that test, providing you the opportunity or the access to take the exam, but certainly not mandating that you come and take the exam on any particular month or any particular season throughout the year. So that's the quick update on the PE. I'm sure there'll be a lot of questions there. The link to the FAQ, and actually, I don't know if we've done it already, but we could actually provide a link right in the chat here. Elena, perhaps you could put that up to the FAQ. These were the frequently asked questions that came out of last week's webinar, either questions that were asked, I believe, in advance or during the webinar, some of which we didn't have time to answer all of them. But the COSGP was very interested in having that published on our website. We've been working on it, and actually it was published on Wednesday night. So there's the link for you from, oh, Kimberly O'Malley just put that up there for you. Thank you, Kim. And so that's available for you. Please check that out. It has a lot more answers to questions, both about the PE exam, also about Prometric-based testing, updates on numbers there, which I'll give you just one line on, and alternate delivery mechanisms for the computer-based exams as well. The one other line on the Prometric Center situation is that more centers are opening, going to be 300 by Monday, June 1st, around the country. More students are testing. We're going to have almost 1,000 students tested within the next week in cumulative since May 4th or 5th, when we had our first COMLEX exam reinstituted. But yes, we understand that there continue to be an enormous amount of frustration on the part of DO students. And with Prometric, with the scheduling system, the rescheduling system, and even the rare case of a student showing up to take a COMLEX exam that is not able to be launched. We find this unacceptable, and we absolutely feel your frustration and your pain. We've made it very, very clear, and I can tell you, despite some lagging systems that Prometric has, and obviously not a very good customer service response early on in the game, especially in May, we've continued to work with them tirelessly, including even individual forwards to the president and CEO, and I speak with him personally at least once a week, as I described in detail last week, and where we literally intercede for students with our COM liaison team, connect the dean, connect the student, connect the Prometric Center, and get people appointments. And overall, we're still in the mid-90 range of level 1, maybe up to 93, 94% of level 1 candidates that were displaced are now successfully rescheduled, the vast majority of which even before August of this year. The number's about 85% on the level 2 CE. a little bit lower on level 3, the residents, but many of them have elected to hold off a little bit in when they're going to take their exam. And then, so we're making good progress there. At the same time, and I won't go into a lot of detail, we're in good shape with the exploration of alternate test delivery mechanisms should either there be another major shutdown or quarantine, or just if we continue, do not meet where we think we're going to be with testing at Prometric centers, and potentially it will reduce some of the backlog a little bit with potentially some regional centers around the country that would help supplement the traditional Prometric centers to take a level 1 or a level 2 CE exam. Lastly, Laura suggested and COSGP suggested that I just speak just a little bit more about our advocacy, both with Prometric and also in the residency program director community. You know that NBOME has been your tireless advocate for both your DO degree, your COMLEX credential, and in this particular issue, we have been advocated very regularly with Prometric. We have helped them to understand, not that I think that they were missing this, but their actions didn't seem to show that. The amount of pain and the amount of frustration that either a cancellation or a confusing cancellation and their lagging systems and such were causing in your world. And we hope that many more of you have had your appointments now confirmed and are getting your Prometric test. And again, we regret that many of you have had the frustrating experience of both the cancellation or the confusion regarding that. Also, we have continued to be, I would say, one of the leading organizations in advocating for rising fourth-year students who are applying to residencies. Both with all the other changes that you have in that application process, we have advocated with the residency program director community that they understand that you might not have test results for all the exams you traditionally might have had come September, or this year it's October 21st, the somewhat delayed ERAS application deadline. And we have really continued with tireless advocacy with the residency program director community to let them know that a good number of DO students will not have their level 2 PE in time, or a pass in time for the October 21st deadline. And potentially with level 2 CE, although right now more than 95% of our candidates are rescheduled in time that they would have a score. We're talking about the candidates graduating in 2021. So they would have a score for the ERAS opening. But I will tell you, we've gotten great pickup from the residency program director community. We haven't had good agreement across the whole coalition about this issue quite yet, but I'm confident we will. And again, the advocacy has been, do not hold a fourth-year student accountable for results for an exam that they haven't been able to take. If you haven't been able to sit for an exam or take an exam, a program director shouldn't be saying, where's your level 2 CE or where's your level 2 PE? They should be able to accept the response that, well, I don't have that exam because I was canceled in June or what have you, and I rescheduled it, and the score will be coming. So anyway, that's the whole update today. I'm sure many of your questions will focus on other things that are of interest to you, and that's what we're here for. So thank you for joining, and I'll turn it over to Dr. Sandella, who will fire away with some of your questions.
So Dr. Gimbel, we already have about 57 questions in the Q&A. There's some in the chat too, but again, I can't really focus on both. So as I said to the students, I'm going to be focusing on the ones in the Q&A. We do go back and do a big sweep up of all the chats as well, just so you guys know, but probably not get to those. Obviously, we won't get to 57, but they are kind of along the themes that you've already addressed. But sometimes I think it's easier to hear, question and answer for the students so they can kind of pose it. And one of the earliest ones that we had was a great question. Since the NBME suspended CS, I hope NBOME follows suit. What is the decision criteria that the NBOME will be using to make those decisions?
Yeah, obviously, as I described quite a bit last week and whatever, it's a very complex decision. Many of you have continued to advocate to say, I need to take my test, I need to have my score, I want it for residency program directors. Of course, many of you also have reached out, usually via social media and others, to say, well, this exam should just go away and we should be either given a waiver or not have to take the test. In discussion with your Council on Osteopathic Student Government Leadership the other day, they were extremely supportive, and they understand why this is the essential kind of core exam of what it is that the licensing boards are looking for and requiring. And I won't go into more detail about that unless you have further questions. But in terms of the actual criteria, we would want to, obviously we need to make sure by law that the testing centers are able to be opened, okay? And there is changing law in different states. We happen to have our national centers in both Chicago, out by the O'Hare Airport, and in Philadelphia, but it's a suburb out by Conshohocken. We're in Montgomery County. So we have to pay attention to the state as well as local legal requirements in that area. We also are studying quite a bit the science, as you are, related to this virus and related to the transmission. And that includes not just our physician experts on our national faculty and on our staff who've been studying this and have all been back in our offices so that we're on the ground. In fact, today, this whole week, we've been on the ground in our offices in Philadelphia and Chicago to make sure we go through all of that to make sure that the centers can be set up, providing providing all those physical distancing and other kinds of requirements that are there. The issue about travel restrictions comes up quite often, and we're studying that state by state, area by area, knowing that those are variable. And that's why we've said all along that you have to attend to your own personal circumstances. If you're scheduled to take an exam in a certain month, let's say September, and you don't feel comfortable coming in September, we would strongly urge you, working with your advisors and others, to contact us and reschedule your examination to a point where you feel comfortable and or the travel restrictions are relieved and what have you. We know that this is really difficult for students who in many cases have been socially distanced or physically distanced from all the other things that they're used to doing. You're not able to go to gyms, you're not able to go to clinical rotations, you're not able to go to even residency application interviews. But sometimes I think there's a misperception as to why that's the case. Why you're not going into clinical rotations isn't necessarily because it's unsafe for you to walk into a hospital. It's very complicated, but the more number of people there are in the hospital, especially if they're not directly providing the patient care, it potentially could distract from the attending physicians and the respiratory therapists and the nurses and others who are taking care of those patients. Also, of course, making sure we would want to make sure everybody had the right PPE and other aspects in those clinical situations. So we know your schools are working really hard to be able to provide you really good clinical learning experiences, both virtually for a period of time and then eventually kind of back directly. Again, I think the misinformation about residency program applications being all virtual because saying it's unsafe, I think is a little embellishment or misunderstanding of why that happened. Part of why all residency program director specialties were advised to, by the coalition, which we are a part of, and we've advocated for you on this, were advised to move those to virtual, was to level the playing field, knowing that many people travel to 10 or 15 different interviews in a short period of time. But if hospitals said, well, we're only going to give live interviews to our students who go to the medical school attached with our academic health center and our residency, that would potentially disadvantage other students from, let's say, a community-oriented medical school, DO or MD granting medical school that may not have as many GME positions attached to it. So it was to level that playing field so that it was a fair playing field, not that, no, it's absolutely unsafe. And very clearly, the message from the USMLE, which I see some in the chat and stuff, and I think would just like to share with you, their message is not, it's not safe to go out of the house for the next 12 to 18 months. And I think that would be a misinterpretation of the USMLE's message. We've worked with them very carefully. We've had a lot of frank discussions with them, and I feel for them with their challenges in terms of the backlog of 30,000+ individuals to take an exam, and international medical graduates who rely on this exam for certification, but and which then gets them into residency. It's called ECFMG certification. They just were very concerned about a lot of pushback they were having from the haves and have-nots, the students who were able to test, but the students who weren't able to test for various reasons. And it was kind of a leveling of the playing field type of a maneuver, not that it isn't safe to go out of your house. And of course, I presume many of you are in states where the governors have shifted the, obviously removed the stay-at-home provisions have shifted, allowing lots of businesses to open. We're only in May, it's still May 29th, and there are already widespread movement across there. And we are certainly hopeful that that will continue and will continue and get to a point where we can actually find that it's safe to resume testing, which many of you have been asking for at that time. We'd appreciate that you take into mind the complexity of the decisions. And of course, as we've said from the beginning, how we endeavor to do everything we can to provide access to testing, but only when we can feel reasonably assured that it is as safe as possible for anybody who elects to take the test as soon as we start resuming, and then obviously those who take the test over the next 2-3 years, or however long that there still will be viral activity before a vaccine or other things are available.
So thank you, Dr. Gimple. A lot of the questions that we got in the there was 4 main themes. I think you already touched on the first one, what's the plan? The second one was what safety procedures are in effect for the exam, for the level 2 PE, that is. And then another one I'd like you to either kind of circle back to is what effect do you think some students having and some students not having either a clinical skills exam for MD students or a PE for DO students have on the residency applications this fall? And is there an option to go to ERAS and say, well, just take level 2 out of the equation for everybody?
Yeah, so as I mentioned in the preview there, we've been very active with our advocacy in the residency program director community. It's tricky because every residency program director has different criteria for what they're looking for in a resident. If you talk with them, there's consistent themes. I think about 25 or 30% of them really put a high stock in the clinical skills exam, in our case, the level 2 PE. They know what that exam tests, they know what it measures. That's what they're very interested in knowing about. And quite frankly, they're frustrated that they're not going to have that 30%, that they're not going to have those results for, as you know, their entire applicant pool. But they're also understanding. Remember, residency program directors are in a situation where they want to make the best fit. They want to find out who's going to be the best fit to be successful in their program. But they also are taking care of patients, dealing with residents. They're right in the front lines of COVID. So they understand that a number of their applicants will not have all of the normal criteria that they normally would have. You might not have a visiting application. You might not have a rotation. You might not have other things. And they're very understanding of that. We have tried to take it to a new level of having each of those different specialty organizations that are comprised amongst residency program directors to take an official stand that says, we get it, we understand, and we're not going to be holding students accountable for exams that they haven't had the chance to take. We have worked tirelessly for you. I appreciate the commentary. NBOME does not stand for residency program directors. I don't know who that is, but it's kind of a mean comment because the NBOME has been your tireless advocate on this issue and on so many other issues. And I think one of the most important things you learn as a physician and whatever is there's a couple of rules, and my staff know I say one of them all the time. And one of them is be kind. And I think as a physician, you're going to have to keep that in mind with your patients, not be judgmental and actually be understanding. And I think that's important. So I appreciate you keep that in mind. And again, we have been your tireless advocate with residency program directors, fighting for you and your credentials and your, COMLEX, of course, credentials. And of course, letting them know that in this particular year with the pandemic, you might not have a level 2 PE, you might not have a level 2 CE if for some reason you're not able to test up until that time. And know that there is still a good number of program directors who will understand that and be understanding of that, I truly believe. And I have good buy-in at this point from the president of the chair of the OBDA, the Organization of Program Director Associations, as well as the AOGME on the osteopathic side. And we're trying to get that to the next level on your behalf.
Thank you. So I don't want to forget our residents who are on. We do have some residents who've joined us. And I have a question from them. For the COMLEX-USA Level 3, how can we do it during COVID? And I think this kind of refers to the fact that you talked about some of the possibilities of doing the other exams at medical schools. Can you comment on level 3?
Well, level 3 was the biggest backlog because we actually had a lot of residents plan to take their level 3 in April and May, and of course, all of the April, and a good number of the May were displaced. It's a 2-day examination at computer-based centers. Actually, we had very little concern. In many cases, the residents, while they were obviously upset to be canceled, and that's, you know, difficult and what have you, many of them just got on and rescheduled for October, or many of them have still kind of said, well, we'll just hold off and see, because remember, they're residents, they're seeing patients, they're working hard, they're doing all that stuff, and they're figuring, I'll take it when I take it. I know I ultimately didn't need to take it in order to get my license. And many times these are first or early in their second year residents, or coming soon. So they still have some time before they finish their residency and want to go and get an unrestricted license. But we fought to continue to get Prometric Center spots open. We are making great progress with that, as I mentioned earlier. And we think that some of the other modifications that are happening with alternate delivery in the next month or two are going to open up even more Prometric sites. I'm still confident that any student or resident that wants to take a COMLEX computer-based exam in the calendar year 2020 will have the chance to do so. So hopefully that's going to meet everybody's needs. And we apologize to the residents who have been, in many cases, displaced from when they wanted to take their level 3 exam.
Thank you. So a student has a question. My school has a near replica of the PE testing centers. Why should they not be able to administer the exam? And again, we're going back to PE.
Yeah, this is a great question. So we get this often from, you know, folks, and since that exam, you know, was first started at one national center for clinical skills testing back in 2004, and then when we expanded to the 2 centers, we still get that. Well, we have the physical space, we have standardized patients, we have this, we have that. What you have to understand is, first of all, again, it's a national standardized exam, so it's real important that all of the elements of that are standardized, not just from the protect the public, you know, the patients, which is our, you know, primary role here, but also so that it's fair for the students. Sometimes these exams are criticized because they're not multiple choice with 5 answer options. They're criticized as being subjective, or students who fail the exam say, I failed the exam because that group of standardized patients didn't like me, or something like that. And I can assure you that while we do use human raters, both the osteopathic physicians from around the country who score the exam elements like OMM and the post-encounter notes, SOAP notes, the standardized patients are also involved in the evaluation, but that those, sometimes people call them walking test items, the standardized patients, are trained up and then calibrated, if you will, to assure fairness for you. That is to say that even though they're all trained to the same rubrics to evaluate your doctor-patient communication skills, let's say, and they're all monitored to make sure that their scores are remaining consistent and what have you, we also equate those scores that you would get from any group of individuals of standardized patients. So that is to say that if you happen to have the most stringent human raters evaluating your doctor-patient communication skills that there are, and your colleague takes the exam, let's say in the other center or in the same center but on a different day and has a different group of standardized patients, we can equate for the degree of leniency or stringency of that human rater. Bottom line is that helps to make sure that it's fair, so that no matter which group of 12 standardized patients, no matter which group of 35 evaluators, when you count the physician examiners that score OMM and SOAP notes and what have you, you get a fair examination. And of course that helps the public in knowing, again, you get a fair examination. And if you've demonstrated your minimal competency and clinical skills, which is what you do in the PE exam, you get a pass, and that's what the public and the licensing boards want to know. And if you have not demonstrated it, you got to fail. Unfortunately, you got to come and retake the exam to make sure you can demonstrate at least minimal competency in those skills. To do that at schools, by the way, to do that and to do that equating and that validation and that calibration, if you will, requires a lot of examinees to interact with the raters, whether they be physician raters or the standardized patients. If you were to disperse our small number of DO students, which is about about 7,000 or so per graduating class, if you were to disperse them, let's say around 10 regions of the country, like at schools, like the question asked, all of a sudden you would have only 1,000 students testing at each, well, if you had 7,000, seven testing centers, let's say, for sake of argument, if you only had 1,000 students rotating at that place, you wouldn't have enough volume of test takers to be able to do that calibration, that equating, to make sure that you get a fair determination of whether or not you're at minimal competency or not. In addition to that, we actually pilot tested it for about a period of 8 years before the PE exam was launched. And interestingly enough, the NBOME, the US MLE that does the clinical skills exam for MDs and IMGs, they had done similarly. And we both had a similar idea that we were going to deliver this at school-based centers around the country. And we ran into numerous barriers and obstacles that both related to fairness, related to security, related to all kinds of other issues that really demonstrated both for them and for us independently that the only fair way to do this in both protecting the public and also making sure students got a fair assessment was to do these exams at national standardized clinical skills exam facilities.
Thank you. A student asked, you mentioned fewer students in the building for the PE exam. Should we expect some cancellations like the cancellations Prometric did for social distancing purposes? If so, will more appointments be available? The students who had their exams canceled in June are now scheduled for February.
Yes, good question. I think we've recognized that, you know, we can't do anything the way we normally do things, right, in all of our lives, right? I mean, that's, you know, weddings. I know many of you have had weddings and graduations and other things forestalled or done virtually. It's just, and this, I think the same thing here. What we're working with our teams is to reimagine to some degree some of that rescheduling, scheduling, and other related things so that if there are additional cancellations that come, whether for whatever reason, whether it's a physical distance, whether it's just because we can't resume the exam quite then, or whether it's another wave, that we learn from the Prometric circumstance in April and May and try to, despite some technology systems that aren't quite where they need to be in managing a pandemic, to at least make up for that with more clear communication, more accurate communication about who's canceled or not, and even some proactive strategies regarding, which we've done in the computer-based exams, where you get on the phone to us 7 to 7, Monday through Friday, Eastern time. We have humans. We'll help to troubleshoot and work with you to get the appointment you need. We're probably going to have to do more of that in the clinical skills world if there's additional cancellations, and we promise to ramp up to the extent we can to be able to provide that. There is lots of additional testing capability in the fall months, including, you know, September, October, November, that we have not released the appointment dates yet for. So if you really, for whatever reason, want to take the exam, not in, I think you said April, Dr. Sandella, not, if you don't want to wait till April and you really want to take it in November, as things get a little bit more clear in the next several weeks or a month or so about whether or not July 1 is likely to happen and whether or not any other cancellations need to be happening, we will be opening up additional spots. We will be contacting those who've been canceled first and foremost to let them know, including those that were canceled in the last month or so, to let them know these additional dates are available. And then we will continue to be available, manning and womaning those phones 7 to 7 to be able to help you to get confirmation of this is what you want, this is your date. And I know we hear this a lot from students. Well, I don't want to give up my date in August, but I might not want to come and take the exam in August. Maybe I don't think my clinical skills are there yet, or maybe I don't want to travel, or my state or other things like whatever. But we have to probably provide you some type of a parachute or some type of a connection to know that you wouldn't have to wait until July of next year to take the test, in my opinion. And that's what we've been working on. We've been troubleshooting it. There are 24 hours in a day. I can promise you we're using up most of them to help you. And this is one of the things that we're looking on. How could we offer to any additional cancellations. Hey, we know you're going to be canceled on this date, but here's what we got. What are you really looking for? What is your priority in terms of when you would like to test? Because we know the vast majority of you want to test and you want to get this exam done and you want to have it. Many of you understand you might not have it by, the opening of ERAS. Maybe you'll have it by rank order list, but certainly you want to probably have it by this time next year in graduation time. And we're working as hard as we can to try to provide you the opportunities to do so.
Can you comment, what is a clear face mask? Did you mean a face shield? I have not heard of any clear masks, and I think that giving students only face shields just so our faces can be seen is dangerous and not protective of the students or the standardized patients. We need N95s if we're going to see 12 standardized patients during this pandemic.
Well, thank you for that. We have various experts who are weighing in on that and reviewing those protocols. That's some of the work that we talked about having our staff here now who are doing, again, including infectious disease, public health experts, and we've been in contact with the CDC as well. The masks that we're looking at are actually face masks. They are clear. They do go over your mouth and nose, so you can still see. They're not shields over your whole face, and that's what we're looking at in terms of providing safe. Remember, the circumstances within the centers are universally supplied with Purell, with soap and water, with gloves, with all those types of things that are commonly utilized. And we believe, again, at which time we offer the resumption and restart of that test, we'll have made that exam inordinately safe for anybody who chooses to take it during that time. And we also recognize that everybody's on has different personal circumstances. There might be different geographic circumstances, their own personal health circumstances. We know that some of you, most of you have not returned yet to clinical rotations or to your campuses. We understand that. And that would make, even though it is still only May 29th, and we had announced publicly the earliest we would resume exams are July 1, many of you, that leads to a lot of discomfort. We are not resuming testing on May 29th. We're saying as early as July 1, and we're going to keep looking at that carefully. And again, making sure that we follow the science and not, just, concerns and fears. But in cases where there are individual fears and concerns, we never would say those are not valid. We would say that you have to, take care of your personal circumstances, make your decisions as to when you're testing. We at NBOME are not forcing anyone to test. We provide the opportunity to test, and that opportunity is going to, help you to get your license. It's what all the state licensing boards want and require. And should you decide to not take it for 6 months or a year, that would be your decision. And we have to support everybody's individual circumstances during this unprecedented time.
Thank you. One of the next questions that I found, and again, I'm going through them as quickly as I can. We can only answer one at a time, but we are capturing all of your questions. I just want to remind you all. And this person had about 8 questions, but I picked out one of them because the other ones I think are more related to the clinical skills exam in general and not related to the coronavirus related issues with the clinical skills exam. What is the justification for continuing an examination given our allopathic counterparts will be licensed without the clinical skills exam?
Okay. Well, I don't know where you're getting your information or how people are going to get licensed without a clinical skills exam. The USMLE announced they were going to suspend their Step 2 CS, and they're looking at other types of things. They do an exam that's designed for allopathic medical practice and for what they consider to be essential to what's being tested. The NBOME and the other members of the regulatory groups across the osteopathic profession believe what's tested in the COMLEX-USA Level 2 PE exam is at the very core of what we do. It's the core of what we do is establish a connection with patients via the medical interview, rapport building, and doctor-patient communication. Unless you communicate directly with a patient and understand what concerns them, what their hopes, what their fears, and what their goals for treatment are, you can't possibly, in many cases, even arrive at the correct diagnosis, let alone help to negotiate a treatment plan, and certainly let alone to make cost-effective decisions and provide safe and efficacious care. If you haven't been exposed to the amount of literature that supports doctor-patient communication and its relationship even to patient outcomes, I hope you'll get some time to review that. It's critical. And for the osteopathic profession, including the licensure community in the DO world, which is represented by the American Association of Osteopathic Examiners, this examination is really one of it assesses the core EPAs, the core competencies of the practice of osteopathic medicine. I mentioned doctor-patient communication. The other piece, of course, is touch, and it's physical examination, it's physical diagnosis, it's laying on of hands, and it's OMM and OMT. And, you know, I've had the pleasure of practicing osteopathic medicine for almost 30 years, you know, and I can tell you that sometimes it's not until you really look the patient in the eye and you really listen, and you listen empathically, that they actually share the secret as to why they came. Sometimes it's not until you touch them, might be doing a physical exam maneuver, examining whatever, that all of a sudden the barriers reduce, and that's when they actually share what's concerning them, or accurate, you know, information about the history. And certainly the information that you glean from manual hands-on palpatory diagnosis with physical exam maneuvers, as well as with structural exam, OMM and OMT, is very critical to the base of what we do. Lastly, I'll just say that this exam measures 5 or 6 of the core entrustable professional activities. Some of you have heard this language, the EPAs, kind of related to competencies, about what residency program directors are looking for and what people are looking for in medical trainees and in physicians. And they involve essentially taking all that history and physical and whatever and putting it all together, coming up with an integrated differential diagnosis, and doing it from history and physical exam things that you have done personally, that you've personally performed, and taking that data and arriving. This is essential for patient safety. This is essential for making accurate diagnoses. And again, in my discussions with other student groups, including COSGP leaders, most people get that. This is the core of kind of who we are and what we do. So what another organization decides to do for MD students and international medical graduates, while it clearly impacts, and as evidenced by your question, impacts what some people might think, I don't want you to be confused if you're a DO student that, that these particular core fundamental skills are not essential to the distinctive practice of osteopathic medicine, and are not essentially considered to be some of the most important things that licensing boards use in order to give a license. So I think that this speaks to the very core of kind of who we are. We benefit in this circumstance by being able to suspend, but suspend for a more finite period of time, perhaps, if we're fortunate to be able to get the exam up and running. And when I started to talk about the numbers of our class, if we can test almost the entire remaining part of the class of 2021 in 6 months and have them have a score by their likely graduation date, provided we actually get restarted and we actually can ramp up and test at relatively full capacity. So we're in a better position to continue to do what our mission at NBOME is, which is about protecting the public and ensuring the public and patients and the licensing boards that anybody who gets DO after their name and also goes to a licensing board to get a license has demonstrated their minimal competency in these fundamental clinical skills, which are not optional for osteopathic physicians.
I think you kind of went near this question, but I wanted to ask him more directly so that the student can hear his question. Suppose not a single DO student feels comfortable to take the PE until after January, including myself, who is currently scheduled for July. Is your recommendation to push everyone's date back? Because now we're talking June 2021.
Is my recommendation that we should push everyone's exam back till
That was the question, yes.
No, I think that, you know, as soon as we are able to resume testing, those who are comfortable in testing and obviously have an appointment and are eligible to take the test would be advised to to take the exam, provided they're comfortable with traveling to the center. Maybe they're local students, maybe they have a short drive, maybe they're also flying for clinical rotations or flying for other, they're comfortable flying and that kind of thing. And it's a matter of, kind of getting out there and feeling comfortable doing, getting used to, carrying your mask everywhere, having your Purell everywhere, which I've had traveling. I saw questions about, have I traveled? Yeah, I've traveled quite a bit. Again, advocating for you. I traveled during the middle of the pandemic in March to a meeting called the UME GME Planning Task Force for the Coalition that was designed at looking at the match system and enhancements. Why was I there and why did I make sure I got myself there? Because I was one of the lone people advocating for the voice of DO students in this complicated thing we called the match and in this transition to UME and GME. So, but we understand that some of you aren't. So for example, the questioner who said, I might want to hold off until January, that's great. I think you would be advised to do that and test when you have a date that you feel comfortable. And if you're uncomfortable with anything like that, you want to talk it over with our staff, you don't want to lose a date, whatever, call our staff, 7 a.m. to 7 p.m. Eastern time, Monday through Friday. That's been our customer service support where you can call, you can email, and you're going to get a response. And hopefully you're going to get an empathetic and accurate response. We've gotten, and by the way, thank you to so many of the students who've been so supportive about that, whether it be on Twitter, whether it be on social media, email saying, we called this place, they didn't answer. We heard they called that place, we didn't answer. We're hearing all these horror stories, but we called you all and we got an empathetic, professional, caring individual who gave us the answer right away. Or if they didn't have the answer, they promised to get back with us. And surprise, surprise, they actually got back with us. Like the student 2 days ago who we heard through the dean, they've been rescheduled. They now have a date that they're really happy with, and they got a phone call from one of our client services reps to make that happen and what have you. That's what we do. That's what we're here to do. We're working tirelessly to do that for all of you. I understand it's still very imperfect and it's very regrettable. It tugs at our strings. We know how much anxiety goes into these types of tests. And we're certainly not trying to add any more. We're trying to add opportunities to test when you feel that it's safe to do so. And we've advocated also with your schools, your deans. I met with the Board of Deans again yesterday to say, if there's internal rules that you're saying about you have to take this test by this, relax those a bit during the COVID era, of course, so that people can take the exams and meet these requirements when they feel safe to do so.
If we do not feel comfortable to take the PE, will the rescheduling fee be waived for us?
Yes, we started this in March where we waived all rescheduling fees. We also, there was a very small increase in COMLEX fees that was due to go on in July 1. We had announced that over a year ago. We had not increased COMLEX fees in a 2-year period of time at all for any of the COMLEX exams. And we've actually held that increase as well. So no student will get bumped, or even if they decide to bump from a date, let's say they decide to not test in May for a certain exam, or the PE exam, they decide to not test in July and they move it to January. That will not cost you anything in terms of rescheduling fees or what have you. We felt very strongly that that was an important thing to do early on. We did it. And as I said last week, and I've said it to your student leader groups and whatever, the NBOME has always been very attentive to extra burden of costs of things. So for example, let's say you have some fee that's not waived of an airline or something else that was related to travel to an exam or related to a Prometric-based center exam. We have a kind of a student special circumstances fund. You can write to us, you can send the receipts, you can put in writing what additional expenses you incurred because of this. And we have typically provided some relief to some students for some of those expenses year after year now for the last 12 years since that's been in existence.
While I appreciate the measures being taken to ensure our safety in the testing centers, the majority of increase we will be exposed to is due to travel. And I'm assuming that this is for the PE. It doesn't say, but that's my assumption. Students will be exposed to multiple flights and airports, taxis, hotels. These are places where social distancing cannot be maintained. In a cycle where we are being asked to forego away rotations due to the risks of travel, how does the NBOME justify us to travel across the country for an exam format that our MD colleagues are not required to take?
Well, I think I've addressed almost every element of that question already. Is there any element that I have not addressed to that?
I think some of the questions we know we're asking, because sometimes it's hard to hear your answer in a question. It's easier to hear your question. So I think what you had said to this was about the examinations and the importance of those, as well as.
Well, and again, I think also students sometimes might be misinterpreting. I don't know for sure. Please don't, crucify me on this, but the, I think because a school says you can't, or the Coalition for Physician Accountability said, we think it's a best idea this fall to kind of limit away or audition rotations. That was done to level the playing field. That was done so that not only home institution individuals, could, come and interview face-to-face or come and rotate. It was meant to relieve some anxiety, relieve some stress, potentially relieve some other even economic and other costs of traveling and what have you. It was a decision made at a time in March and April of putting together what's the best thing to do. It wasn't intended to be a message that it's going to be unsafe for you to travel for the next, 12 months. And I think there's certainly possible that those recommendations could change with a surge or with other issues. But even in some of our biggest hotspot areas like Michigan, I saw Michigan folks, we always hear a lot from Michigan and Pennsylvania and New York, because those are places where we have a lot of DO students and a lot of DOs, more DOs in those 3 states, I think, than almost the rest of the country. So we hear a lot from individuals from there. And we know that some of the most stringent state requirements and precautions and travel warnings are still in those states. But even those are considerably lightening up. At least they're predicted to, this week, next week, the week after, major modifications that are occurring over that time. In terms of the risks, there was something about fights in the streets or something. I missed that part and I didn't kind of see that connection, but anyway.
This question comes from, or is about, I don't know if it comes from, but it's about our military HPSP students. Is there any update on priority dates or appointments for HPSP military students who cannot go to active duty until all board exams are completed? Asking in case of a second wave and more cancellations. And thank you all for your service.
Yes, thank you very much to our military students. We've always recognized at NBOME that the military students have additional kind of deadlines and requirements and such. I honestly don't know what the military armed forces are doing to modify some of those requirements. I would imagine they're looking at those carefully, like all of us have been, and all of the other regulatory authorities and such. So I don't want to speak to that. I don't know the answer as to what they're doing. Our client services staff get special training on some of the particular issues that the military folks have in terms of test dates and when they need to do that. We've tried to be very responsive, but quite frankly, we treat every candidate like a VIP, at least in terms of when you call and talk with somebody at client services, when you email us, the expectation, at least in our organization, I'm not saying we live up to it 100% of the time, we're all human. The expectation is we're going to listen to, just like you with your patients, you're going to listen to the question actually being asked. You're going to try to address what the fears, concerns, needs, and other things behind the question are. And then you're going to hopefully give accurate information. And if you don't know the information, you're going to say that, and you're going to say, this is how we're going to get back to you with the correct answer. So if there's something else that we need to understand about the military, but I would imagine you as a military student, if that's who's asking this question, is already advocating with your ambassadors on your particular branch of the military to let them know that there just isn't going to be the ability to take a certain exam by a certain deadline, perhaps, given the COVID-19 circumstances.
Another question is talking about, just to kind of tilt a little bit. The administration, are there any update on administration of COMLEX computer-based examinations at the schools?
Yes, so most of you know and you've seen updates. I believe there's a public update going out today as well, because about every couple of weeks we've been putting official written updates on our website about many of these broad areas. And the one is the exploring alternate options for computer-based tests. We've been very aggressively pursuing these since March. Various concerns I spoke about last week and are in the FAQs about why we couldn't, flip this on a dime to like an internet-based solution or something delivered proctored at the schools or something. But it doesn't mean we'd ruled it out. It just, we knew we had to put a lot of safeguards in place. We had concerns also from students saying, well, is it fair? I took my exam at Prometric. How come she gets to take it at a campus or this or that? And we've tried to work through all those. We have a couple of models that are gaining a lot of traction for potential temporary solutions as early as July. They do include satellite regional test centers that are Prometric hardware and equipment proctored, of course, at select school-based centers that have the physical space and the other things to be able to do it. We would select those carefully to be in regions of the country that are diverse, but also that they would be able to take on students from other schools or residents, not just their own school students. And it would be a limited number, and it would only therefore put a small dent in the overall number of test takers, but that could help. The other one is a kind of more of an event-based option that would be delivered at potentially many more schools, but on one single test day event or a couple of single events, so that we essentially deliver the exams, synchronize all the timing, and then destroy the exam forms. In other words, don't use them again in COMLEX immediately thereafter those administrations. These are very out-of-the-box types of thinking, but we've continued to explore that. We're showing great promise and no major reason why, at this point, at least one of these options will not become available. But at the same time, with the great expansion of the number of our candidates that have gotten confirmed test seats now at Prometric over the next couple of months to take their, especially level 1 and level 2, these will be important for second waves or additional viral activity shutdowns that could happen in the fall or the winter or whatever, which some models predict. So we have to be prepared for that. But by the same token, we will have these options. We were already exploring some of these even before COVID-19 became a reality for all of us. It was on our priority goal list. And we wish we had already had that in place up through now. But again, many things that were completely unpredictable or at least unfathomable for many of us since we haven't had one of these in over 100 years is Monday morning quarterbacking. We wish we had had all that lined up, and we will for the next time for sure.
I think we have 1:59, so I'm going to hold you to one more question, Dr. Gimple. Have you considered requesting input from outside groups regarding whether testing should or should not resume so that the decision is unbiased?
Yeah, so I think you're talking about the PE exam, perhaps?
I think it is. It doesn't specifically say that.
And yeah, I think I had said earlier that we have had external review already. We have additional levels of external review, including experts, but also your own COSGP, student government leadership, because we think that we had talked about shooting a video that actually talks about all the different safety precautions in the center. I thought if that student was willing to be on the video, he or she could help us to actually show you what these masks look like, what the spacing looks like, what we're intending to do, before we start that testing. A COSGP expressed a lot of interest in this. We're still working out those details, but absolutely. And again, we're endeavoring to provide access to testing, provided we know that it can be reasonably safe and that you elect to come back and retest. And I think we've talked quite a lot about that question today. And I appreciate the concerns, and I know you share the same concerns we have, trying to keep everybody as safe as possible, also trying to provide you and everybody with the opportunity to demonstrate your skills, your competencies, so that you continue to progress as a DO and you continue to be able to live your dream, which is getting a license to practice and then practice osteopathic medicine over the course of your career. So I hope we got to most of them today. Again, do go to that FAQ link from last week's webinar or review last week's webinar. A lot of that information is still, I think, valid. We will endeavor to keep you updated both through your Council of Osteopathic Student Government Presidents, as well as our public updates on our website. And again, our apologies for all of the anxieties created by this COVID world. We are all in this together. And for the vast majority of you who have been very, very kind, very, very supportive, albeit expressing very professionally what some of your concerns are and whatever, we really appreciate it. We're very proud of you, and we're going to be glad to really welcome you kind of fully into the profession and as colleagues. But we certainly already consider you part of the family, and we hope that you recognize how we're trying to take care of you like members of the family through this very difficult time.
Thank you, Dr. Gimple, and I thank all of you for attending with us today. We had almost 500 attendees today that I can see in the participants. Over 175 questions. Right now we're at 178. So type fast if you want to get your question in, and I'll ramble a little bit for you. I want to thank our COSGP leaders. I know that some of them are monitoring the chats with us as well. So thank you all so much for doing that. And if the COSGP wants to go in and put anything in the chat, I'll ramble a little bit for them. I know that they had to put some stuff in for students to be able to reach out to them as well. Again, nbome.org/COVID-19. That way you can get information on the PE, on also the computer-based testing as well. We've recorded this and we're going to make it available. Next week, we're hoping Monday on the recording. The FAQs take a little longer because we will go through now 181. I'm going to get us to 200 questions, 181 questions, and we go through them. I got only about a third of the way down as I'm scrolling and selecting questions for Dr. Gimple. I like to read your questions as you suggest them, but sometimes you had 5 or 6 questions and I pulled one out. But I hope some of you did hear your voices in here so that you know that your questions are getting answered. And then other questions were similar to ones that had already been asked and answered. So I skipped them for now, but hopefully you at least saw kind of what your concerns are. If you have personal concerns, because there were some of those that I kind of slid by that were just about your personal situation, we do recommend, and I'm going to get Kim, her fingers typing here, we do recommend that you contact our client services. So client services at nbome.org. And also you can call them 7 to 7 Eastern time, Monday through Friday at 866-479-6828. Again, 866-479-6828. And again, if you have a personal question about a situation, I saw a couple of those for people with some extenuating circumstances as well. And they can also answer those questions like Dr. Gimple, and there was a couple of people who had questions about what if my flights get canceled, all that kind of stuff with the extenuating circumstances that you can apply for that as well. Thank you all so much for joining us again. This is not an easy situation for anyone. We thank Dr. Gimple for doing this. And again, thanks to COSGP, who's been a great partner. And we've been communicating with them since last Thursday on what you guys needed to happen during this. So thank you all. Take care.